And with that, I would like to welcome Dr. Yosep Chong from the Catholic University of Korea. He will be talking about digital cytology. Very interesting area, right? About the challenges, the advancements, and so on. Over to you, Chong.
Thank you for the kind introduction. I'm Yosep Chong from the Catholic University of Korea, and I'm going to talk about the current challenges and recent advancement in digital cytology. So this is my disclosure and my introduction. I have a YouTube channel if you guys can check out for further information, and my research guide for my recent publication. And I have some all the different topics related to digital pathology and AI. So today I'm going to talk about the importance of cytology and the technology behind digital cytology and the major use cases of digital cytology, including primary diagnosis, telecytopathology, and rows, rapid on-site evaluation, and education, quality assurance of digital cytology, and AI and research in cytopathology. So as you might all aware of, we are expecting as an example of Korea, we have exponentially increasing number of cytologic exam over last 20 years, and it will be much more expected to be grow. So an annual workload, the international recommendation is 6,000 per year per person, but actually we're dealing almost double and more than triple for cytopathologists and cytotechnician a year. And this is the global estimation on histology and cytology market. And it is estimated to grow more than double in 5 years and more than 4 times, quadruple in 5 years, more than in 10 years. So, and actually quite a lot of amount of these all exam will be cytology, like actually more than 80%. So why cytology still increase even though it is not confirmatory test? Because it's a simple, rapid, and less invasive and cheap. But still there are many challenges, including it's a very labor-intensive, time-consuming task, and there is a limited accuracy and sensitivity. So poor diagnostic performance is a major limitation of cytology. So that was the, but now we are expecting it can be changed by the help of AI and digital cytology. So I would like to address briefly about the technology behind digital cytology, because the digital pathology technology was more explored in histopathology area rather than cytopathology, because it needs more intricate and delicate technology for cytopathology samples, because it's mostly one single layer of cross-section of tissue in histopathology sample. So between the focus depth is less than 3 to 5 micrometer, but thin smear can be quite similar to the histopathology samples, but if it's like thick smear or LBC, it can be three-dimensional between copper slide and glass slides. So it needs more the consideration in the technical aspect. So we need the Z-stack. So in the manual inspection, we use our 3D, we use the controller to adjust the micrometer depth Z layers. But for the scanning technology, we need Z stacking. So we need to scan the multiple layers like in one area, So we need to combine everything. So in this part, we also need the extended depth of focus technique, which is in the combining multiple images with the better image focus in one single image. So this is a technical challenge. Yeah, so these are the images thanks to Akira Yoshikawa. So thank you for providing these wonderful images, and it will be in our review next review paper. And because of disease stacking, we inevitably need to expect the larger size of images than histopathology. It can be more than almost 10 times in the conventional smear. So now to overcome this kind of limitation, there are multiple different strategies, including oblique scanning, which is also called volumetric scanning. So you can scan the slides this way in the oblique way, and you can combine, automatically combine the cells in focus. And recently there's another Korean company who is inventing the multi-camera, multi-focus Z-stack scanning, which is they try to use 3 different camera at the same time with the different Z layers, and they can save the scanning time, but at the same time they can get the well-focused, evenly focused image, single image. So what would be the major the use cases of digital cytology? The first one would be primary diagnosis, and in the remote area, telecytopathology and rows, and remote consultation and education, quality assurance and archiving and research, and AI assisted screening and diagnosis. So major use cases can be illustrated this way. So primary diagnosis and telecytopathology roles, and QA and AI assisted diagnosis, and education and research. So the workflow will be this way. The major difference than the conventional workflow would be there's a scanning process. So we need to do the pre-scan QC. We need to make sure every slide is well prepared for their scanning, following scanning steps. And we also need to check the images, scanned images, the quality of the scanned images. And so after these scanned images, after we get these scanned images, you can do the primary screening and second review with or without AI assistance. So if it's like a normal, then it can immediately report by the primary screener, and you can be double check if it's the more than ASCAS. So this will be the typical workflow, but still the problem is the technology that supports the digital cytology is yet mature. So we can see this, that according to these different scanner vendors, you can see that the scanning area is completely different, and the image quality can be also very diverse. So we need more standardization. We need higher image resolution for cytology. But so it was not initially included in the ASC guideline, but recently, last year, there was a global survey and there was a guideline by ASC. So you can see that on the half of laboratory are adopted the digital cytology scanning, and in North America, and in Asia, and 30% in Europe, and academic center almost 46%. But the thing is that compared to the research and other education, archiving, and these things, the primary diagnosis, only 50% of the laboratory are using primary diagnosis, using digital cytology for primary diagnosis. And it was only less than 6% in another survey by Pinto, Dr. Pinto et al. So, and 68% are still using microscope in cytology, even though they have the digital pathology system. So they prefer traditional microscope because of lack of Z-stacking mode in some scanners. So why they are not hesitated to adopt the digital cytology technology in the digital pathology technology in digital cytology, because they're not sure. We're not sure about the scanning technology, and we might want better slide image qualities. So it's also same in Korea survey this year. So we have almost 20% of laboratories adopted the digital pathology system in Korea, in the old laboratory in Korea, but none of them are using digital cytology for primary diagnosis. And the reason why they hesitated to use digital cytology is budget and unfamiliar needs and suboptimal quality of the cytologic images. So even though there's this kind of the skepticism in the pathologists, the ASC felt that this is right time to announce the standardized the recommendation for validating this system for primary diagnosis, because more and more laboratories are using this system. So the case volume, we need more than 60 cytology cases for their validation, and we need to ensure the 95% diagnostic concordance, and with 2 weeks of washout period. And we need formal personal training, and we need the quality assurance program, and we need to revalidate if any major component has changed. And last year, another ASC telepathology task force team also published the validation recommendation for rows. So you need to you need to validate the entire cytology system in all rows implementation sites, and to all individual involved in rows, and minimum 60 cases for validation and document concordance between telecytology and microscopic diagnosis, and it should be more than 90%. So these are the quality assurance for digital cytology, and there should be the education and regular QC meeting and the external proficiency testing. So you need to prepare all the SOP for these details. It will be published soon in Acta Cytologica, so it'll be better for you guys to check out, but because the limited of time. And you can see that some of the international QAP services, including UK NECAS and KBAS and Spain and Korea, we are adopting more digital cytology for their quality assurance program. So in Korea, the concordance rate was really great, and the satisfactory rate was really great. And there are also various educational material provided by IAC and ASC and PSC and so on. So I'm going to talk the last about the AI tools. So now we have more than 8 and including more than 20 different companies for the GYN cytology, and many AI softwares in non-gynecology cytology. So these are for the GYN commercially available AI tools in GYN, and this is AI studies recently for the non-GYN cytology, and this is a commercial software for thyroid, urine, and body fluid. So this time is really exciting, and it will be very exciting to transforming all the practice of cytology in near future. Thank you for their attention.
Thank you, Dr. Chong, for your insightful overview of advancements in digital cytology, a truly evolving field. And the topic, we got several questions and feedback from our audiences in our previous webinar. As you shared, cytology has several challenges in digital pathology workflow. Thank you for your great talk. We